Good morning. My name is Bruce Stevenson, and with my partner there, Linda Piccinini, we are today's dental consulting. As you can see, I've been kicking around for a little while in dentistry, coming up on 37 years now. Linda joined me about 30 years ago, first as a chairside assistant, and for the last 20 years as the office manager. So between us, we have a fair amount of experience. And we like to share this a little bit, both with our consulting and also in little videos like this. So today what we're going to talk about is what's going on with Delta Dental. They are the largest dental insurance carrier in the United States. Now keep in mind that what we're going to present here is based on the best information that we can find after multiple phone calls with Delta, sometimes getting conflicting information from Delta, but this is sort of a consensus of what the Delta reps found and what we've been able to find out. Also, you're going to get our opinions today, and keep in mind those are opinions. We do the best we can, and we think that what we're saying is absolutely accurate, but as Ronald Reagan said, you want to trust but verify. Our objective is to keep you from losing so much money by not dealing, in this case in particular, with Delta Dental, but also just in general in the way that you run your office. I think we can't afford to lose this kind of money anymore. This is a graph from an article which was in the November 2014 ADA Journal. And what the author was saying was that dentists' income are very much affected by the laws of supply and demand. And if you see the dental care spending, the red line, increased up until about 2008, and it's kind of flatlined since then. The supply of dentists, the number of dentists graduating from dental school, sort of flatlined until about 2008. And then it started to increase. And if you look at the average net income of dentists, this is nationwide, you can see about 2008, it really started to go down, actually a little bit sooner, about 2006. And the author's premise is because of the laws of supply and demand, dental incomes are going to continue to fall. Oh, that's not very good news. To us, what that means is that you need to pay attention to what's going on in your practice. You need to be more efficient about how you run your office and leave less money on the table. And particularly, don't give dental insurance companies back money just because your staff doesn't know how to bill correctly. So, we're going to talk a little bit here in particular about Delta Dental. To the best of our knowledge, Delta Dental has 3 different types of plans. They have a whole bunch of groups in each of those plans, but they're basically 3 different types. The Delta Premier plan, which pays at the highest fee schedule, and everybody knows about that. That used to be the only plan available. The Delta, what we call the Standard PPO plan, that's our term, and we'll show you how they reimburse for this in a few minutes. And then one that supposedly, according to Delta, they don't have very many of, and that's what we've called the Trader Joe's type plan. Again, this is our term, because Trader Joe's is the first one that we saw that has this particular kind of plan. Now, it's important to understand this, because this is determining not only how much Delta is going to give you, but how much your patients are going to give you. All right. You can see the old codgers over there on the right-hand side, and that's where my picture belongs. Most of the people who are Premier-only providers are dentists who have grandfathered in prior to about 5 or 6 years ago. I'm not sure of that date. But if you were a Delta member prior to this date, you could remain a Premier-only provider. If you signed up more recently as a new dentist, then you're required to sign up as a PPO provider, but you can also sign up as a Premier provider. Excuse me. If you're a PPO provider and not a premier provider. You need to run right back to Delta and become a premier provider in addition to the PPO provider, okay, because it's costing you money not to do that. So Delta has two fee schedules. These are basically contracts with dentists, with their participant dentists. They have the premier fee schedule and they have the PPO fee schedule. So if I'm a dentist who is both a premier and PPO provider, I have two different contracts with Delta, one with a premier fee schedule and one with a PPO fee schedule. All right. If I am a premier only provider, I only have a contract for the premier fee schedule. So again, what kind of participant you are and what plan your patient has determines both what Delta is going to pay you and what your patients are going to pay you. Let's talk about fee schedules for a minute because there's an awful lot of misunderstanding about how fee schedules work. We're talking about fee schedules in your computer. So you want to have one fee schedule in your computer for each insurance company with whom you have a contract. If you don't have a contract with that insurance company, then you don't have a fee schedule in there for them. Actually, you do. It's your UCR fee schedule. So you have one fee schedule for each insurance company with whom you have a contract, a signed contract, and then you have one additional fee schedule, which is your UCR fee schedule, which is probably higher, should be higher than all your other fee schedules. And so if you have a patient come in, excuse me, who has, let's say Aetna, we'll pick on Aetna. We say we don't have a contract with Aetna. So that patient and that Aetna insurance is going to be tied to the UCR fee schedule. If you have 5 contracts with 5 different insurance companies, then you're going to have a total of 6 fee schedules set up in your computer. You're going to have one for each of those contracts, and you're going to have your UCR. Now, garbage in, garbage out. We see this all the time, that offices have a zillion different fee schedules, that over the years, they have put a fee schedule in for each insurance plan. No, absolutely wrong. Do not do that. That is costing you money and it's extremely inefficient. Also keep in mind that Delta actually can be considered as 2 different insurance companies and you have 2 different contracts. You have one for premier fees and a second one for PPOs. All right, so in the case of Delta, you're going to have 2 fee schedules in there, plus your UCR fee schedule, plus a fee schedule for each of the insurance companies with whom you have a contract. One fee schedule for each of those insurance companies with whom you have a contract. So you're going to have lots of different insurance plans tied to these fee schedules. I'll show you in just a minute what I'm talking about. And I mentioned before, if you do not have a contract with that particular insurance company, and there we said it was Aetna, but of course it's obviously different in all the other practices, then you're going to tie Aetna to your UCR fee schedule. And very importantly, you need to keep these fee schedules up to date. So if you have revised your Delta Premier fees, which you should do once a year, as soon as that's okayed by Delta, you need to make sure your staff puts those new fees into the computer. If Delta updates their PPO fees, you don't get to negotiate very much with Delta about PPO fees. But when they update the PPO fees, you need to make sure that you have the most current fees entered into your computer. So here's our example. We have 3 different fee schedules set up in the computer, but we have lots of different plans, and these are just made-up plans, tied to those fee schedules. So with our UCR fee schedule, we have our Aetna plans among a bunch of others. Aetna, because we said we don't have a contract with Aetna. So we're automatically going to assign all those Aetna insurance groups and all those patients that have Aetna plans to the UCR fee schedule. Now, Delta Premier, we have some plans which are Delta Premier plans. The employers have bought Delta Premier plans, and we tie those to our Delta Premier fee schedule, which is a higher fee schedule than our Delta PPO. We also have some Delta PPO plans, and those are tied to the Delta PPO fee schedule. This is assuming you accept Delta PPO. If you don't, then you're going to tie those Delta PPO plans to your Premier fee schedule. All right, let's take a look at an actual reimbursement from Delta. Now, this is going to be true whether you are a Premier provider or a Premier and PPO provider, because this is a Delta Premier plan. Now remember, the Premier plans pay at a higher fee schedule. So we're going to submit our UCR fees. We always submit UCR fees to all insurance companies by default. Now, let me explain. This does not show up anywhere except on the insurance claim that you submit to the insurance company. It does not show up in the patient's ledger. It doesn't require you to do any kind of adjustments. You always put your UCR fee on the insurance claim for all insurance companies. Okay, now, again, doesn't show up on the patient's ledger. You're going to bill the patient total $198. That is your contracted fee with Delta. But you're going to submit the $251. Now, this is not shaky. This is not some underhanded thing. This is actually the way Delta wants you to do it. This is not illegal. Okay, this is what Delta wants you to do. So be sure and do that, because Delta is making increases based on everybody's submitted fees. If everybody just submits the lower fees, Delta's not going to increase anything. All right, anyway, so here's our accepted fee. Here's the contract maximum. Now, there's a difference. You know, the numbers are the same here, but we're going to come to a difference in a little while. And here's how much the patient pays. So you can see the patient's going to pay 20%, and Delta's going to pay 80% in this particular example for this particular procedure code. Okay, let's take a look at a Premier provider for a patient who has a regular, what we call regular PPO plan. Now, we're still going to submit our $250 UCR fee, but our contracted fee with Delta is only $198. Now, we've got a $50 deductible. It's kind of throwing things off here, but what's interesting is that Delta is going to pay this PPO plan just as if it was a Premier plan. The patient's portion is going to be 20%, and Delta's portion is going to be 80%. So in this case, with this particular kind of regular PPO plan and a Premier-only provider, Delta is paying it just as if it was a Premier Delta plan. Well, that's really good. I'm happy about that as a Premier provider. That may be kind of a surprise. You may think, as a Premier provider, that you don't have very many Delta PPO patients in your practice because you don't see them based on the reimbursement. But they're there, and you actually have a whole bunch of these because Delta does not have very many Premier plans left. So the implications are kind of interesting. What if Delta changes their policy and decides that instead of treating all these PPO patients as Premier patients for Premier providers, we're going to now change the fee schedule, and we're going to consider them PPO patients? That could really impact your practice, and we'll talk a little bit more about that. All right, here we are. Now we have a Premier provider and what we call the Trader Joe's type of PPO. Again, we submitted the UCR 251. Our accepted fee is $198, but the maximum contract allowance is only $106. This is different suddenly. This is actually the PPO fee schedule fee. Okay? What's the impact of that? Well, if you look over here, the patient gets to pay a whole lot more money. You're still going to be reimbursed $198 total between patient and Delta. But Delta is only going to pay $53, and the patient's going to pay $145. Now, this is for a premier provider for this different kind of PPO that Delta has. Patient's going to make up the difference. So look at some pie charts that are kind of saying the same thing. So here we are, it's a premier plan. So the premier and PPO providers are treated exactly the same. Okay, the total 251 that we submitted, we're going to take a $53 hit to participate in Delta, whether we're premier or PPO providers. Okay, Delta is going to pay $158. The patient's going to pay $40. Okay, that is for a premier plan. Now, if you are a PPO provider, you need to make sure that you tie that patient's insurance to the premier fee schedule. Otherwise, you're going to leave a lot of money on the table, both with Delta and with the patient. All right, what about the standard plan? If you're a premier provider, you don't see any difference, which is what I think is rather interesting. Okay, they're paying the PPO plans as if they were premier plans for premier providers, at least at this point in time. How about the PPO Trader Joe's plan? Okay, this is where it gets even more interesting, because suddenly the patient's portion jumped up a whole bunch. Okay, you can see how much change there is now in the blue. Now, I, as a premier provider, still get reimbursed a total of $198. So I get the $145 from the patient plus $53 from Delta. So I'm reimbursed the same thing. So, but suddenly the patient's portion is a whole lot more. And we better explain this to the patient before we do the treatment, and then have to come back and say, oh gee, we underestimated or overestimated how much Delta was going to pay. We need to know this going in. So we need to know, as a premier provider, whether or not this is a standard PPO plan or it's the Trader Joe's kind of plan. How do you find that out? Well, it's kind of hard. We'll come back and talk about that. It's not easy to do. All right, here we are, a PPO provider with a standard plan. Okay, no big deal. You're taking a big hit belonging to Delta, okay, because your UCR fee is $251, but your contract, your PPO fee schedule, is only $106. So, but you know that already. That's the way all the PPOs work. Trader Joe's plan, there's no difference, okay, because you're already contracted with the lower fee. Okay, so let's look at the difference here between the the premier only provider and the PPO provider. If I'm the patient and I go to a premier only office with this kind of plan, I'm going to have $145 out of pocket for that particular procedure. If I go to a PPO provider office, I'm going to be $21. Whoa, that's a really big difference. 7 times more. This is only one procedure to go to a premier office. That puts me as a premier provider at a real disadvantage compared to the PPO providers. Now, the PPO providers, look, are taking a tremendous big hit here, but again, that's the way PPOs are, and I'm only going to take my standard Delta hit. So you need to understand, I think, how this works. So I mentioned before, how do we find out if this is a Trader Joe plan or a standard plan? Well, most of the time you can just look on the Delta website, you can go on one of the insurance estimation services, you can look in Trojan, and it will tell you. Not in this case. You cannot tell the difference between the standard and the Trader Joe type PPOs, any one of those 3 places. Okay, this is kind of sneaky, I think. I wouldn't call it secret, because if you call up Delta, they will tell you. Now, don't ask them about a Trader Joe's type plan, because they don't know what you're talking about, because we made up those terms. But you can ask them how much is reimbursed and how much is the patient portion. You can also online on the Delta website, do a pre-estimate, and it will give you that information. But you can't just download it from the Delta website like you would any other information. So to me, Delta's being a little bit secretive and a little bit sneaky and going to surprise that poor kitty cat, and this poor kitty cat are the dentists. Okay. Again, this is my opinion. So a little summary here. If you are a Premier only provider, signing up in addition to being Premier as a PPO provider will dramatically reduce your payments for Delta patients, both from Delta and from the patients. So I would say that's not a very good idea, at least at this time. Also at this time, if you're a Premier only, it probably is not advantageous, at least in my opinion, to drop Delta. Now, if you are a Premier and PPO provider, that's sort of a different story, and you might want to look at that. But as a Premier only provider, I would say this is probably not the best time to drop Delta. Time goes on, we'll see what Delta does, and might change my mind on that. So you definitely need to know which fee schedule Delta uses for the patient's PPO. You need to know whether they're regular or Trader Joe's PPO, because it makes a big difference if you're a Premier provider in how much the patient portion is going to be. You always charge your Delta Premier fee schedule for all your Delta patients at this point. Okay, and you always submit your UCR fees. So your patient portion, your patients are going to be obliged to pay much more of your fee if they have the Trader Joe's PPO plan. If you're both a Premier and a PPO provider, always check to see if the patient has a Premier plan. Because if they do, and there are still some Premier plans out there, then you're going to bill at a much higher rate for both Delta and for the patient. So your reimbursement is going to be much better if the patient has a Premier plan. If it's Premier, make sure you charge your Delta Premier fee schedule and not your PPO fee schedule, because Delta is perfectly happy to pay you a lower fee. And if you submit the lower fee, Delta is going to say, oh, well, thank you very much. You just gave Delta a real big discount and you gave the patient a real big discount. So I think that's really silly, but we see it all the time. And it's because people don't, office staff really, and dentists don't understand how this stuff works. So you need 2 fee schedules in your computer for Delta if you're a Delta Premier PPO provider. And it's very important that you keep those current. We already talked about that. So, mentioned before, this is the best information we could get based on lots of phone calls. You want to trust but verify. You want to always have your most current fee schedules in your computer. They need to be updated very frequently, as often as they change. Now, this is the problem with having 8 zillion different fee schedules in there, because somebody set up each different insurance plan with a different fee schedule. How in the world are you going to update all those things? Because if you have, let's say, a Delta PPO from, in this case, let's say it's from Trader Joe's, and you got another one from a whole bunch of other ones from somebody else, and each one has their own fee schedule, when the Delta PPO fee schedule changes, you have to change it in all those plans. Otherwise, you're not billing the patient the correct amount, and you're going to shortchange yourself. And you're going to have a lot of adjustments, and you're going to have a lot of explanation to the patients. So again, always bill your UCR fees to Delta and all plans, not just Delta. And if you're a Delta Premier provider, hopefully everybody is, in addition to maybe being a PPO provider, you need to update your Delta fees at least once a year. All right, don't let this happen to us. Let's be a little bit more efficient. Efficiency and dentistry are usually not used in the same sentence, but they need to be. We need to pay more attention to this. The nuances are important. Otherwise, we're just throwing a whole bunch of money away. And more, it's reaching the point where we just can't afford to do that. This is the last slide of our little video, and I sincerely hope that you found it useful. Today's Dental Consulting does all sorts of things. We do the consulting training, webinars, little videos like this. We do seminars, and now we even have a book about how to run a modern dental practice. So you can find all these things on our website at todaysdentalconsulting.com, along with a whole bunch of other stuff. And again, I hope you found it useful. I hope you have a nice day, and I hope you have a more profitable dental practice.